Hello and welcome to the show. My name is Maria Mbwe and this is Health and Lifestyle, a show that inspires you to adopt a healthy lifestyle. We bring you real-life stories and experts to discuss issues that concern you. Our social media platforms at Maria Mbwe, at KBC Channel 1 on X and KBC Channel 1 TV on Facebook is where you can interact with us. Coming up in this program.
They did the x-ray and the teeth hazikuwa zimesimama vizuri, so they were like, this one have to go.
The cost of neglecting dental health. Oscar shares his experience.
It's been shown that diabetes is worse in people who have poor oral health, especially periodontitis.
Your mouth, the gateway to your overall health. Dr. Godfrey Maronga explains. And on Good Practice, we learn about oral hygiene. First things first, despite being largely preventable, oral diseases are among the most prevalent non-communicable diseases globally, with negative health and social and economic impacts on people over the course of their lives. Now, Oscar had always been a bit lax about his dental hygiene, brushing too quickly and skipping flossing. Here is his story. Oscar's busy lifestyle once left little time for self-care. Today, he's here for a dental checkup, but it's the painful memory of a root canal that brings him back regularly.
Yeah, for sure. I have one root canal, a premolar and upper premolar on the right. I got this because of lack of flossing. Like I didn't get the message early enough. So huko nyumbani, you don't have to floss and do what. I come from Ushago where we don't know what flossing is. I got the message late and I had a cavity. The doctor said that it was starting in between the teeth. So juu sikuwa na floss, ilikuwa inaanzia katikati. And I've also had the removal of the molars.
Oscar's journey with dental health began much like many others. Years of neglect began to manifest in subtle ways. Occasional sensitivity, a dull ache here and there. Oscar ignored these signs. It wasn't until a severe toothache struck that Oscar realized something was seriously wrong.
Like there is no day utasema ati cavity ilianza na sasa ati imesimama. Cavity huwa inaendelea tu ikikuwa mbaya. So huwa inaanza ikiwa ndogo kama yangu mimi I neglected it. Ilianza ikiwa cavity ndogo, ikakuja ikakuwa kubwa, nimeiacha tu. So it reached a point imekuwa like the doctor said the nerve is compromised and there is nothing a doctor can do to save the nerve. So yeah, sure.
Determined to avoid future issues, Oscar committed to a stringent dental care routine. He started flossing daily, brushing thoroughly, and attending regular dental checkups.
But I like flossing because ukienda kufloss, utaona the bad breath ikitoka. It means kunakuwa na uchafu yenye imebaki katikati ya meno. So I don't want to go back to root canals and what. I don't want to go to that. So I keep on flossing. Want to make sure. Hata ingine hii inaweza brush, but flossing to me it's key and it's always on point. Toa hivyo. So just do your annual checkups. Visit the dentist. Have your teeth cleaned by the dentist so that when you're going home, you'll continue doing the same thing. But 6 months, just visit the dentist. If you're good at everything, maybe once a year.
Oscar's experience underscores a critical message. Neglecting dental hygiene can lead to costly and painful consequences.
Oral health encompasses a lot of things because let me tell you, dental procedures are very expensive. And they can be very easy if you just take your brush rightly, and just floss. So I wish ningepata hiyo message mapema, but I didn't. And I don't regret. For now, I know everything.
Indeed, the key is catching the tooth decay early and avoid the high cost of treatment, just as Oscar has already explained. And as the saying goes in Swahili, usipojenga ufa, utajenga ukuta. Or, prevention is better than cure. Now, we wanted to know how well people know how to brush their teeth on Word on the Streets.
I only brush in the morning and in the evening when I get back to the house. Yeah.
Personally, mostly I just do brushing of teeth in the morning and before I go to sleep, that's at night. And also sometimes when you're walking within the streets, you need to have some chewing gum, yeah, so that you ensure that you're breathing nicely and fresh.
So using a soft brush, but brushing it very well, maybe you can take 2 minutes to make sure that you remove all the food stuck. Then you can gargle water most of the time, yeah, so that you can also remove the, the, the foods from the throat. And also drinking a lot of water can help.
I was losing all my teeth, but I removed two. But now, due to the care that I've been taking, brushing 3 times, sometimes due to the work I may not do it 3 times, but I can do it in the morning and evening with the paste, and then make sure that there is some dental toothpick that I use to avoid the eroding the gums and so forth.
Long time ago, I would say we never used to take care of our teeth because, of course, our parents did not have the resources to do that. But nowadays, I can say I do make sure my kids visit the doctor, and I also make sure that I also do the same. But I would also encourage maybe the doctors or the dentist, we should have many camps so that we can be educated, because not most of us, or not everybody knows that following up on your dental hygiene is very important.
We Somali, we use the normal stick. The others who use the toothpaste. The others who use the boiled water with the salt. But personally, I use mostly the stick, and I use rarely the toothpaste. But I go to the dentist twice a month, so that at least he can check my dental health or any other problem that may arise, and that is what I do.
We hear a lot of information on how to keep our hearts healthy, eat right, and even exercise. But did you know that your dental hygiene has a direct link to keeping your heart beating properly? Well, Dr. Godfrey Maronga is a doctor of dentistry. He's here to make that connection between oral hygiene and our health. Thank you so much, Dr. for making the time to be with us today. And just like I've already introduced, could you just explain to us how oral health affects our overall health?
There is a big connection between our oral health and the general health, although a lot of people, as you have correctly pointed out, do not actually know that link. Now, as you have mentioned, heart disease is one of the problems or one of the diseases that could actually be linked to poor oral health. But there are also several other diseases which, maybe just to mention, there is a correlation between poor gum health, commonly known as periodontitis, and also diabetes. It's been shown that diabetes is worse in people who have poor oral health, especially periodontitis. There is also a correlation between poor oral health and poor outcomes of pregnancy. For example, people who have poor oral health during pregnancy are more predisposed to preeclampsia, and they are also exposed to the possibility of having preterm babies and also babies who are underweight.
So, Dr. Before we continue, could you just explain to us, like in layman's language, what is preeclampsia?
So, preeclampsia is basically an elevated blood pressure. Somebody was not hypertensive before they became pregnant, but once they are pregnant, then their blood pressure starts going high and high. And many times, if the preeclampsia is not well controlled, they may actually end up losing the pregnancy. So essentially, preeclampsia predisposes or poses a big danger both to the mother as well as to the baby. Yeah, so still, as I was explaining, the other diseases also are upper respiratory tract infections and lower respiratory tract infections have also been linked with the poor oral health.
So gum disease is a very big one, and that is like gingivitis. Maybe you could explain to us how gingivitis or gum disease affects our overall health, how it develops and becomes a big problem later on.
Okay, so when we talk about gingivitis or diseases of the gum, they are mainly divided into two. The earlier or the milder form is called gingivitis, and the study, the Oral Health Survey of 2015 in Kenya, found that up to 90% of the population actually have gingivitis. Now, there is a possibility that gingivitis, if it's not if it's not managed, then it can advance now. So the advanced form of gingivitis, now you have periodontitis. So now it's not just the gum that is inflamed, because gingivitis is basically inflammation of the gum. Now you advance that and you have now periodontitis. So periodontitis is not just now the gum that is involved. The gum is there. The bone that surrounds the bone is also, that surrounds the teeth is being damaged. And the fibers or the ligaments that support the tooth inside the bone are also being damaged. So that's the advanced form. Now, what has been found out is that this kind of inflammation of the supporting tissues of the teeth, or gingivitis and periodontitis, is actually initiated and propagated by bacteria. Now, these bacteria, some of them have actually been found to, be involved in those other, when swabs are taken and isolated, they actually find that the same bacteria that are in the mouth are the same bacteria that are found in other places of the body. The mineral fluoride is a double-edged sword, in the sense that it has positives and it has negatives. When present in sufficient amounts and not excess, especially topical, meaning it's applied on the teeth, we don't swallow the toothpaste. So that helps to strengthen our teeth. When we teach students, we explain the mechanisms in details, but it essentially enables the enamel, the outer layer of the tooth, to become more firm and to be remineralized. And it has also been shown to inhibit the bacteria, or destroy the bacteria that cause tooth decay. The problem with fluoride, if it is ingested, or if it's taken either in drinking water or in cooking water in sufficient amounts, then it starts to cause some weakening of the teeth and the browning of the teeth that is called dental fluorosis. Now, there are a lot of ways that can be done, or a lot of things that can be done to deal with that, but the main thing is just to remove the fluoride so that whatever is there in the water, drinking and cooking water, is not excessive.
So maybe, Dr. you could also explain to us some of the symptoms of gingivitis or gum disease, because some of these diseases develop over time and you're likely not to have any symptoms at all. How then does somebody know that, in as much as I'm feeling okay in my mouth, I probably have a disease that is underlying?
That's a good question. You see, what we say with oral diseases is almost, it's actually the opposite of what we say with the criminal justice system, where we say you are innocent until you are proven guilty. For dental diseases, we usually say that you could actually, or you actually have a dental disease unless your clinician has said otherwise. Okay? Now, there are some telltale signs that can tell you that there is a problem that is going on, which then you should look out for and seek treatment at the earliest. So, like gingivitis has, the first thing is that you could be having some discomfort in the gum, and that is pain. So maybe you take food there, it's uncomfortable. You try to brush there, it's uncomfortable. So there is pain. Some people will notice swelling in either all the parts of the gum or in a few areas. The other thing that you could pick up is bleeding gums, because every time there is inflammation, there is increased blood flow to the gums. So either somebody is bleeding spontaneously, or when you brush your teeth and you are, spitting out or expectorating the toothpaste, you just find that there is blood that is in that toothpaste. The other thing is malodor, or bad smell from the mouth. And this one is the most sensitive one, because I really have to be comfortable with you to tell you that, I can just smell that you have bad breath.
It's quite interesting how we, underestimate our mouths, because we only think about our mouths in terms of being able to speak or being able to chew the food and all that. But again, the mouth can actually be your early warning system in the sense that even a dentist can be able to identify a problem before it erupts just by looking at your mouth. Could you explain to us some of those early warning systems and how you can able to, by just looking at the mouth, you're able to, tell that there is a certain problem that is developing?
Yes, indeed, the mouth is a gateway to our systemic health, and there are a lot of things, and you can be able to pick up. And now that is why more and more the discussion is moving towards dentistry or oral health being integrated with the general health, because there are a lot of things that we see that could tell that there is something that is going on. For example, if somebody comes and we have these gum swellings that you are not able to pick out where they are coming from. Personally, I've had patients that I saw, somebody had the gum was so much swollen and I could not relate it with the gingivitis. So I referred these patients, and this patient was diagnosed to have actually been having a type of blood cancer that is called a leukemia. So the mouth could inform us that. If we also have like periodontal diseases, the patient is brushing, they are doing everything that they need to do, and still we are not controlling the gum disease. Sometimes we have said, hey, let's check what your sugar is. And we find, because a lot of people who actually are diagnosed with diabetes, they did not know that they were actually diabetic until they start to see the damages that are caused. But the mouth is one of the areas that we could pick up and we get that the patient is diabetic.
Thank you so much, Dr. Maronga, for taking the time and explain to us how our oral health is actually connected to our overall health. And if you thought that your oral health does not matter, then I think it's time to think again. I thought I knew how to brush my teeth well. Well, that is until I met Dr. Sharon Kendi. For instance, did you know that you're not supposed to completely rinse the toothpaste in your mouth after brushing your teeth? Well, Dr. Sharon Kendi answers some of your frequently asked questions on the good practice.
Hello, my name is Dr. Kendi Sharon, and I'm a general dentist at Enamel Elegance. Today on the Good Practice, I am going to be responding to the most frequently asked questions with regards to oral hygiene. I have divided these questions into 4 different parts, being the 4 different components that play a role in your oral hygiene. These are your toothbrush, toothpaste, interdental cleaning aids, and mouthwash. So I'm going to start with your toothbrush. The most frequently asked question here is, what type of toothbrush should I use? Now, there are different kinds of toothbrush available in the market. The major differences here being the electric toothbrush and the manual toothbrush. Both of them play the same role. If you're in a privilege and you can buy an electric toothbrush, it would serve you best. However, your manual toothbrush can serve the same function. In the Kenyan market, we have also seen something that we refer to as mswaki. Mswaki is actually a herbal branch or stem that people can chew and use to clean their teeth. This is also something that can work just like your toothbrush. Another question we get asked a lot is, how should I brush your teeth? How should I brush my teeth? Now, you need to be taking your toothbrush in a circular kind of motion. So of course, you put some toothpaste on your toothbrush, and then you need to be taking your toothbrush like this in a circular motion. Whenever you do that, you need to take your time. We recommend that you brush for at least 2 to 3 minutes. So take your time. A normal toothbrush is going to be covering only 2 teeth at a time, and you need to be doing about 5 cycles per 2 teeth. So you make sure you brush in a circular motion and you contact the gum area. Make sure you do that. All the surfaces, you go on the outer surfaces, and then when you're done, you open, and then now you can scrub the chewing surfaces. When you're done with that, you need to also clean the areas close to your tongue on the lower jaw, and on the upper jaw, you need to clean the areas that are close to your palate. Once you're done, don't forget to brush your tongue as well. Some toothbrushes may come with a tongue cleaner at the back, so you can use that, or you could buy a separate tongue cleaner for that function. Another question we get asked a lot is, when should I change my toothbrush? We recommend that you change your toothbrush after every 3 months. Also, if you get a flu or a cold, remember to change your toothbrush. So 3 months, and anytime you've had a respiratory illness or you've been coughing, make sure you change your toothbrush. Another question is, Is it safe to share my toothbrush, especially when you've gone for those sleepovers and you've forgotten your toothbrush? Can you share? We will respond to this: no, do not share your toothbrush. A toothbrush is a personal effect and we don't encourage you to share it because every single individual has a different composition of oral bacteria, which of course are transferred to your toothbrush. Therefore, it is important that you do not share your toothbrush. What are the risks if you happen to share your toothbrush? You might be transferring some respiratory illnesses, especially the viral ones, because most of the times the viruses that remain on your toothbrush are not going to die so easily, even if you follow the correct routine for cleaning your toothbrush, okay? Another question we get asked is, how should I clean and store my toothbrush? So what we recommend is, if you can get some hot water after you do your brushing, dip your toothbrush in it for at least a minute. Just immerse your toothbrush and let it just, kind of stay in the hot water. You can add some salt to the hot water because it helps to disinfect your brush. After you've done that, make sure you get something to cover your toothbrush. There's things that look like this that you can store your toothbrush in. They are not very expensive to buy. So you just put your toothbrush inside here and it helps to protect your toothbrush from any dirt or any sort of contamination that might occur from the external environment.
We've come to the end of the program. Thank you so much for taking the time to watch the program and also for participating in this particular program. On behalf of everyone who made this program possible, Dr. Sharon Kendi on the good practice, and definitely Dr. Godfrey Maronga for teaching us how our oral health is connected to our overall health. And if you thought that your oral health does not matter, well, think again. My name is Marie Yambo, and if you've missed any part of this program, do head to our YouTube channel where you'll be able to watch the whole program. Until next time, goodbye for now.